Elderly population is increasing every day. A woman turning 65 today is expected to live 86 years. A man turning 65 years today is expected to live 84 years. So we will have more and more elderly people in the future. Increasing older population. By 2050, one-fifth of total US population will be 65 years or older. This is a huge opportunity for services which help seniors, including geriatric care management. There is significant increase in number of senior service providers in past 5 years. Increasing older population. The number of Americans aged 65 and older is projected to more than double from 46 million today to over 98 million by 2060. And the 65 years and older age group share the total population will rise to nearly 24% from 15%. Increasing demand of elderly care. Obesity rate among older adults have been increasing, standing at about 40% of 65 to 74 years old in 2009 to 2012. Increasing demand of elderly care. More older adults are divorced compared with previous generations. The share of divorced women aged 65 and older increased from 3% in 1980 to 13% in 2015, and for men from 4% to 11% during the same period. Increasing demand of elderly care. More than one-fourth, which is 27% of women aged 65 to 74 lived alone in 2014, and this share jumped to 42% among women aged 75 to 84 and to 65% among women aged 85 and older. Increasing demand of elderly care. The aging of the baby boom generation could fuel a 75% increase in number of Americans aged 65 and older requiring nursing home care to about 2.3 million in 2030 from 1.3 million in 2010. Increasing demand for elder care. Demand for elder care will also be fueled by a steep rise in number of Americans living with Alzheimer's disease, which could nearly triple by 2050 to 14 million from 5 million in 2015. Increasing demand for elder care. The large share of elderly also means that Social Security and Medicare expenditures will increase from a combined 8% of gross domestic product today to 12% by 2050. Increasing demand for elder care. Policymakers can also improve the outlook of future by reducing current gap in education, employment, and earnings among younger workers. To manage all the care needs for someone can truly become a full-time job. Geriatric care management provides a solution for those who simply do not have time to provide all the care management themselves. Why someone needs to hire a geriatric care manager? Adult children who are short on time because they are still raising their own children and maintaining full-time job. Adult children who do not live near their parents. Siblings who want to avoid disagreement connected to one of them acting as care manager. Seniors who do not want their children to become responsible for their care. Why someone need to hire a geriatric care manager? Seniors who do not have family members available to manage their care. Seniors who have multiple medical conditions and need a professional to help navigate the best care solutions. Seniors who find easier to communicate with non-family members due to emotional issues or memory losses. Minimum hours. Geriatric care managers may be hired for one-time assessment of individual to determine their care needs and coordinate a plan of care, or for ongoing services. Usually there is a flat fees for initial assessment, which is charged by the hour, and 1 to 3 hours may be needed. Cost between $60 and $120 per hour typically are charged depending on your location. Initial visit is normally $200 to $250 per hour, and at least 4 hour session we can expect for the first time. Some managers charge flat fees of $800 to $1,000 for first visits. How it works. Geriatric care managers will meet with client on one time or an ongoing schedule to keep care on track and to accompany the seniors to doctor's appointments and other necessary appointments such as visiting potential care communities. Ideal qualification for this position. Registered nurse, licensed counselor of social worker, counselor of psychology, and sometimes attorney. What areas of services are covered by geriatric care managers? Medical care needs, caregiving needs, home safety, medications, nutrition, hygiene, mental anxiety or depression, financial requirements, insurance, socialization. What planning geriatric care managers do? Arrangements of care services, coordination and communication of medical care, liaison between family and legal, medical and financial providers, connection to community resources, assistance with residential placement or relocation, management of care providers, including caregivers or caregiving agencies. What is the advantage of this service? Provides third party to take out of emotional issues which may complicate care when family members are the care managers. Local managers to maintain accountability when children do not live nearby. Professional coordination and communication between all care service providers. Professional feedback on medical care. Advocate to interact with medical professionals during hospitalization or rehabilitation. Do you think this information was useful for you? If yes, are you interested to know more about starting geriatric care management business? We have very good offer for you. You need basic understanding of gerontology and long-term care institutions. We have basic gerontology course which has been utilized by thousands of satisfied clients. We are giving offer to all existing subscribers of Gerontology course to access this course for free, and if you purchase Gerontology course, you will be able to access this course for free as well. In this way, you will not need to spend thousands of dollars of consultation of starting this business. In this course, we will guide you step by step to start geriatric care management business.